In this video, we'll be seeing about the kidney. So, kidneys involve the process of excretion. Excretion is a process by which the unwanted substances and metabolic waste are eliminated from the body. Many organs involve the process of excretion, like skin, lungs, liver, and many other systems, like digestive systems, remove excessive waste from the body. But their capacity of excretion is to a limit. But renal system or the urinary system has a maximum excretory capacity, and so it plays a major role in homeostasis. So in this video, we'll be discussing about the renal anatomy, physiology or the microscopic structure, the renal failure, and some treatment options for that. So renal anatomy. So first question, when it comes to anatomy, what will we see? Where the kidney lies or where the kidney is situated. The kidney lie on the posterior abdominal wall, one on each side of the vertebral column, behind the peritoneum and below the diaphragm. They extend from the level of 12th thoracic vertebrae to the 3rd lumbar vertebrae, receiving some protection from the lower rib cage. So the thing is, liver is occupied the maximum space in the lower abdominal region. So usually the anatomy will be like the right kidney will be slightly lower than the left. Kidneys are bean-shaped organs about 11 cm long, 6 cm wide, 3 cm thick, and weighs 150 grams. And they are embedded and held in a position by a mass of fats called perinephric and paranephric fat. A sheath of fibrous connective tissue called the renal fascia encloses the kidney and the renal fat. So then, moving on to the coverings of kidney. Kidney is covered by the following structures: a fibrous capsule, a perirenal fat, renal fascia, and a pararenal fat. Each has a separate role for its structure. The last three structures supports the kidney and hold it in the position on the posterior abdominal wall. That perirenal fat, renal fascia, and the pararenal fat. Those things supports the kidney and hold in the position on the posterior abdominal wall. And this is the anterior view of kidney with the associated structures. So the association structure with the right kidneys: duodenum, liver, hepatic flexure, and small intestines, a part of small intestine, and comes the renal artery. And at the top, adrenal glands are present in both the kidneys. So the kidney receives the blood from the abdominal aorta, and then it splits into renal artery and drains into renal vein, and finally drains at the inferior vena cava. And on the left side, it is covered. It is associated with stomach, spleen, pancreas, jejunum, and splenic structures. So as I discussed there, and we have discussed only the anterior and superior views. The posterior, the right kidney, the posterior view has associated organs like the diaphragm and the muscles of the abdominal wall. The same with the left kidney. This is a beautiful longitudinal section of a kidney. On a cross section, the kidney will be showing a cortex, a fibrous capsule, some major calyx. Major calyx is nothing but 3 or 4 minor calyces combined to form a major calyx. The renal artery, renal vein, the ureteric branch, renal pelvis, the ureter. And in the medullary sections, it shows the medulla, which has the renal pyramids and some of the circulations to the kidney. So, in a gross structure of kidney, we can visualize the three sections like the outer cortex, inner medulla, and renal sinus in the hilums. So the outer cortex, how it appears. It is a reddish brown layer of tissue immediately present below the fibrous capsule, which is outside the renal pyramids, that is outside the medulla. Medulla is the inner portion. This cortex is present outside the medulla. So this contains the renal corpuscles and the convoluted tubules. Those are the functioning units called nephrons. And at intervals, the cortical tissues penetrates the medulla in the form of columns, which call the renal columns or the columns of Bertin. Moving on to inner medulla. It is the most innermost layer. It contains the tubular and vascular structures arranged in the parallel radial lines. The medullary mass is divided into 8 to 18 medullary or the Malpighian pyramids or the renal pyramids. The broad base of pyramid is in contact with cortex and the apex projects into the minor calyx. Moving on to renal sinus. It has an upper extended part of ureter called the renal pelvis and the subdivision of pelvis 2 to 3 major calyxes and about 8 minor calyxes. That is, a group of 5 to 8 minor calyces forms 2 to 3 major calyxes. Each kidney has the range of 5 to 8 minor calyces and which groups into 2 to 3 major calyces. The renal sinus has got branch of nerves, arteries and tributaries of the vein and a loose connective tissues and fat. Now the hilum. It is the concave medial border of the kidney where the renal blood and lymph vessels, the ureter and the nerve enters. Urine formed within the kidney passes through a renal papilla, which is at the apex of the pyramid, into a minor calyx. Several minor calyxes merge into the major calyx, as I said, or 2 or 3 of them combine forming the renal pelvis, which looks like a funnel-shaped structure that narrows when it leaves the kidney as ureter. It means the precursor for ureter is renal pelvis. The walls of the calyces and the renal pelvis are lined with a transitional epithelium and contain smooth muscles.